Hey, Staten Island, it's Top of Owner reporting for the Staten Island Advance. This is another edition of Together SI Business Spotlight. Our conversation to get you into the weekend is going to be with Dr. Ami Raval, a neurosurgeon with Healthcare Associates in Medicine, a division of Orland and Cohen Medical Specialists Group. Doctor, how are you?
Good. How are you?
Excellent. Thank you so much. So, Doctor, let's get into what you do and talk to us a little bit about Healthcare Associates in Medicine.
So I am a neurosurgeon. I treat surgical disorders of the brain and the spinal system, the vertebral system. I've been part of Healthcare Associates in Medicine for the last 6 years. It is a large accredited private medical group that's been in business here on Staten Island for over 50 years. Up until fairly recently, we were the primary group providing neurosurgical services to the community of Staten Island.
All right, Doc. So let's get talking about health. I mean, wow, what the past 7 months have been, huh? Let's talk a little bit about COVID-19 and this pandemic. The reason why we began this series was to highlight businesses and their reaction and pivoting. Talk how it affected you and your constituents, the patients, and what life was like the past few months. Give us a little inside look here.
It's really changed how we practice medicine. I never thought that we would have to transition a lot of our services to telemedicine, but we've done here at Healthcare Associates a great job in doing that. A lot of our outpatient visits were transitioned for a period of time, and we still continue to do so, conduct visits via telemedicine. The virus, of course, affected elective spine surgery for us. And so for a brief period of time, a good portion of the elective surgeries were canceled. But we continue to provide any emergent or urgent care to the Staten Island community at the hospitals.
Okay, so despite the fact that elective surgery was not possible, you are still working on emergency case-by-case basis. Is that what you're saying?
Yes, that's correct. Yeah.
Okay, so you're still working and still having your colleagues with you and on board for anything that was an emergency. All right, let's look forward now. We're in this modified phase 4, Doc. For your business and for what the Healthcare Associates in Medicine do with regards to neurosurgery, what do we foresee in the fall or in the next 6 months per se? I know we don't have a crystal ball. We don't know what the CDC is going to say. We don't know how this virus is going to react come the fall. But give us a general broad brush overview. What do you think is going to happen in the coming months?
Currently, we are seeing an upswing in the cases and the patients that are coming in. I think a lot of the patients, due to the trepidation and the anxiety of the virus, were avoiding medical facilities unless they absolutely needed to be seen. But currently, patients are coming in. We are performing elective surgeries and seeing patients at all 3 of our Healthcare Associates in Medicine locations. Over the course of the next 6 months, it's hard to predict. I'm hopeful that now that we have hopefully passed the peak, that we will continue to, even if there are small upswings in the virus incidence, that we'll continue to provide services, and the hospitals will continue to allow us to provide elective surgery services. I'm hopeful.
And talk about people coming back to, in the Staten Island community, coming back to your locations, Doctor. The safety precautions that you have set forth, you and your team, in accordance to CDC, and everyone a little nervous, to be quite frank, to go back and let the Staten Island community know what you are doing and that it is in fact safe to go back.
Yes. So all of our locations, including our practice locations on Highland Boulevard, on Targee Street, and even our imaging centers, we're taking standard precautions. We're testing all of our employees via temperature checks and all of our patients via temperature checks. We are, of course, as always, maintaining cleanliness precautions and keeping all of our facilities as clean as possible, and limiting the exposure, limiting the number of patients that come into our office at a time, and who we see at a time. In the hospitals, we're doing the same for all elective surgeries. The hospitals are taking very strong precautions. Everyone that is scheduled for surgery is undergoing COVID testing. So I feel that right now is the safest that we've been over the course of the last 6 months, I think, to treat patients.
Excellent. So those who have any type of neurological issue can come and see you, doc, right? And you are ready and armed to do that, and your staff. Let's get to our last question here with about a minute to go. A silver lining, if you would, just something, a positive note that we can end this interview on, that you've seen. I know before we started, we talked about the community and doing all this together. Talk a little bit about what some good takeaway of all this.
I think this has been a clear example of how close knit the community of Staten Island is. The community is the majority of the community is our essential workers, frontline workers, and it's been really gratifying to see how they've all come together to support the community of Staten Island, to support the patients, and to work together to make sure that we got this virus under control. I'm so proud that the incidence of the disease has decreased to such a low level, and I think that's because the whole community has come together with the wearing masks and being as clean as possible and practicing social distancing. So it's been a great example of how great the community of Staten Island has been.
That's right. We've all been on board. And again, this is Together SI. We have to be in this together in order to get through it. Dr. Ami Raval, thank you so much for the time today.
Thanks for having me.
All right. Once again, Dr. Ami Raval, she is neurosurgeon with Healthcare Associates in Medicine, a division of Orland and Cohen Medical Specialists Groups. All right. And with that being said, I think take a second to thank all of our frontline workers like Dr. Ami Raval, working around the clock, I'm sure, along with all doctors and nurses, FDNY, NYPD, EMS, anyone who was working through the pandemic, specifically the tougher months that Staten Island had throughout March, April, and May. But hats off to everyone who's been part of the effort responsibly and getting those to reverse that curve, to decrease that curve, right? And to be at the spot we are in this modified phase 4, slowly getting businesses back up and open. That's what this spotlight has been all about. All right, that'll wrap that up for this edition of Together SI Business Spotlight. My name is Tom Bavona, reporting for the Staten Island Advance, and we will see you next time.